Good afternoon. Welcome back everyone for our session 2, part 2 of our oral session, Patient Safety and IPC, under pa rin po tayo ng Hospital Operations Track. So again, our session chair for today, Dr. Bituin Reyes, our medical officer for under Health Facility Development Bureau, and truly your session coordinator, Joana Lico or JJ, under the same bureau po. So, Doctora, the floor is yours. Thank you.
Thank you, Ma'am JJ. Again, I'd like to greet everybody. Good afternoon and welcome back to this parallel session on patient safety and infection prevention control, or IPC. It's one of our 10 sessions under the Hospital Operations Track of the First National Hospital Week Research Forum. So I'd like to acknowledge the attendance of our presenters, of our chiefs of hospitals who may be present here, and all our esteemed guests. As you know, in this session, we shall acquaint ourselves with 3 abstracts that successfully qualified for presentation. Each again of the researcher presenters in the session shall have 15 minutes to present their papers, after which we will allot 10 minutes to answer questions from the audience. The audience will be on mute during the entire session, and the audience can post their questions on the chat panel of this virtual session room. The chat panel can be accessed through the button at the bottom of the screen. Only one question should be answered live. And please identify the presenter you wish to ask, then the question next. All questions posted will be included in the documentation of the subject. So before we close the session, we shall have some synthesis of the presentations and some announcements on the forum program. So to share the presenters in this session, first we'll have Ms. Cherry Luya from Southern Isabela Medical Center presenting their paper titled The Patient Safety Culture Among Healthcare Workers in a Tertiary Public Hospital. Second, we'll have Mr. Moriel Fortune Mateo from Mariano Marcos Memorial Hospital and Medical Center presenting their paper titled Call for a Cause and the Pediatric Patient Cause. And third, we have Mr. Joseph John Biel from Zamboanga City Medical Center presenting their paper titled Perceived Social Constraint and Physical Exhaustion Among Caregivers of Adult Hemodialysis Patients. So to our researchers, thank you for joining this forum, and congratulations for making it this far into the initiative. Of Ms. Cherry Luya, you have the floor.
Thank you very much. Good afternoon, everyone. I'll be sharing my presentation. Okay, thank you very much. Good afternoon once again to all our panelists and also the attendees of this First National Hospital Week Research Forum. I am honored to present to you our study entitled The Patient Safety Culture Among Healthcare Workers in a Tertiary Public Hospital. I am Cherry Lu Aryap, a nurse at the Southern Isabela Medical Center, and I am the main author of this study. And I would like to recognize my co-authors, namely Angelica Pilium, Dr. Butch Reto Garcia, Ma'am Mia Lovella P. Mabayad, Ma'am Sheena Ulrich P. Barrian, and Ma'am Reggie Ann Agbayani. According to the Joint Commission International, safety culture is the sum of what an organization is and does in the pursuit of safety. Culture of safety is an integrated pattern of individual and organizational behavior based on shared values, attitudes, perceptions, competencies, and patterns of behavior that strive to operationalize a culture according to the World Health Organization. According to AHRQ, Agency for Healthcare Research and Quality, organizational culture refers to the beliefs, values, and norms shared by staff throughout the organization that influence their actions and behavior. Patient safety culture is the extent to which these beliefs, values, norms, shared by healthcare staff are rewarded, supported, expected, and accepted, and it exists at multi-level system, hospital, department, and unit. But what makes or what composes a culture of safety? According to the World Health Organization, a culture of safety is an organization that accepts the responsibility for the safety of all, prioritizes safety above financial and operational goals, encourages and rewards the identification, communication, and resolution of safety issues, provides for organizational learning from accidents, and provides appropriate resources, structure, and accountability to maintain effective system. Here at Southern Isabela Medical Center, which is a 350-bed capacity DOH-retained tertiary medical center in Region 2, is a participant of the patient safety research conducted by the University of the Philippines College of Medicine under the Department of Health Advancing Health Through Assisted Decision program since 2018. The objectives of our study is to assess the current status of the patient safety culture and determine the strengths and areas for patient safety culture improvement. Here at SIMC, assessing the patient safety culture of the institution is vital for the improvement of a developing culture. We will identify the strengths and areas for patient safety culture improvement by identifying positive safety scores from the survey, which will be of great help in enhancing the patient safety program of the institution. So the methods for the methodology of this study, it is descriptive, and we base the total population or the sample size of the study based from the total number of participants who attended the patient safety capacity building, dubbed as team strategies and tools to enhance performance and patient safety. The participants are 419. So we researchers computed the sample size with expected rate of response of 50%, margin of error of 0.05, and confidence interval of 95%. The sample size is 216 and an added 20% buffer to the attrition rate. So the total sample size is 260. However, the response rate of this study is 91.53%. And we utilize random sampling. So the data collection tool of this study is an adopted and validated survey from the Agency of Healthcare Research and Quality, dubbed as Survey on Patient Safety Culture, which composes of 40 survey items, and these are the following: communication about error, communication openness issues, handoffs and information exchange, management support for patient safety, organizational learning, reporting on patient safety events, staffing and workplace response to error, supervisor support to patient safety, and teamwork. After the technical and ethics approval of the PECSHO, data gathering began during the last quarter of 2020. An informed consent that includes the purpose, benefits, and significance of the study was explained to the respondents. Frequency and percentage were utilized for the respondents' profile, positive scores of culture of safety composites, and ranking for the areas of strengths and weaknesses. The survey includes both positively and negatively worded items. Calculating the percent positive scores on an item is different for positively and negatively worded items. For positively worded items, percent positive scores are combined percentage of respondents within hospital who answered strongly agree, or always, or most of the time. For negatively worded items, percent positive response is the combined percentage of respondents who answered strongly disagree, or never, or rarely, because a negative response or a negative answer on a negatively worded item indicates a positive response. So this is the first, this bar graph reveals the average percent positive scores of the patient safety composites. As you can see, these are the strength, the areas of strength of among the respondents. The areas of strength which garnered 80% and above are the following: feedback and communication about errors, which is 90.42%. Organizational learning is 87.49%. Supervisor support to patient safety is 86.55%. And teamwork within units is 82.48%. Among the composites, the lowest or the areas for potential for improvement is staffing and workplace, which is 46.14%. The overall positive or overall average of positive scores is 71.41%. This bar graph reveals the patient safety culture at the hospital level. Based on the composite, 61.06% represents management support, and 67.23% represents handoffs and transition, which is an area for continuous development. This bar graph presents the positive scores of safety composites at unit level. At the unit level, areas of potential for improvement is still staffing and workplace. It reflects a major implication for the institution. The composite includes workload, how long the staff work, and if the unit relies too much on temporary staff. Areas of continuous development is communication openness and non-punitive response to error, which falls to 60% to 67.71%. This bar graph presents the number of events reported in the past 12 months by healthcare workers at SIMC. Majority of the respondents, 47.47%, don't have any reports from the past 12 months. However, there are 45.75% who stated that they reported 1 to 2 events for the past 12 months. In addition, there are only 6.30 respondents who reported 3 to 5 events in the past 12 months. The overall patient safety rating among healthcare workers at SIMC reveals that majority of the respondents gave an overall patient safety rating of very good to excellent. However, there are 29.83% respondents who gave an overall patient safety rating of good to fair. So for the conclusion of our study, the patient safety culture among healthcare workers should be developed to a progressive state where safety is fully integrated in all processes by implementing strategies and tools to enhance performance. For the recommendations of this study, here are the following. Correct patient safety ratio with role clarity. Major reassessment of the staffing directly aligned to the needs of each unit is necessary in order to properly address the needs by giving the emphasis to the roles and responsibility of the permanent staff. Next is the use of ISBAR communication tool. Staff should use a standard and effective communication tool like ISBAR, introduction, situation, background, assessment, recommendation method during patient referrals, and communicating pertinent information data to other healthcare workers and patients. In addition, there should be a monitoring system how the staff communicate with each other. To increase patient safety report, we have to establish and strengthen the reporting and learning system, must emphasize that is for organizational improvement. In addition, it is highly recommended to reward areas that identifies, reports, communicates, and find resolution to patient safety issues. And it is also highly recommended to conduct a multidisciplinary patient safety round to develop a proactive reporting, and learning system that composes of a multidisciplinary team, and to strengthen hospital management to support for patient safety, learning and development interventions, capacity building among healthcare workers for patient safety should be a top priority to raise awareness and in-depth understanding among healthcare workers and provide adequate resources that promotes a culture of safety among patients in hospital as a whole, and as well as the utilization and implementation of the team strategies and tools to enhance performance and patient safety. And these are my references for this study. Thank you very much, Agyamanak.
Thank you very much, Ms. Yap. So congratulations on your report and your presentation into the entire
You're welcome, ma'am.
Again, we encourage our audience to send in their questions through the chat panel. So next, let's proceed with the second presentation to be delivered by Mr. Morel Fortune Mateo. You have the floor, po.
Sige po. So, no sick and pediatric patients deserves to get sicker and weaker because of falling accidentally in a hospital during his or her confinement. I'm here to present po our simple research work titled Fall for a Cause and Pediatric Patients Fall. So this is actually a continuous quality improvement study which was completed in 2019. By the way, I am Maurel Fortune C. Mateo, your presenter, a nurse supervisor of the Pediatric ICU Clean of the Mariano Marcos Memorial Hospital and Medical Center in Ilocos Norte, City of Batac. With me is my co-author, Dr. Carla Modesta C. Albano, who is currently at her fellowship training in PGH Manila. So without further ado, I'd like to start off with this slide. So since this is a CQI study, I have to alter po the template for the presentation given to us by the organizers, as some parts there are not applicable to ours. So I end up with these 4 parts, namely the background, the root cause, the solution, result, and benefits. So let's go first po to the background. Sorry. Okay, so in the recent past po, 7 incidences of pediatric accidental falls were recorded in our pediatric ICUs and in our pediatric wards. These incidences happened on 2018, which were in April 7, June 25, August 11, September 3, and 14, and in 2019, which were in January 6 and 25. If we treat po the 7 incidences, statistically, that would give us a 0.28% of patient falling in a quarterly basis. It may look as a small number because it hasn't even reached 1%, but we cannot be complacent about it, and we should treat this seriously because these patients are not admitted, as I've said a while ago, to just get injured or to get sicker while being confined in the hospital. So being that said, we pursued this study with an objective to attain a 0% incidence of fall by the 3rd and 4th quarters of 2019. Okay, so let's go to the root cause. So we have identified 8 specific causes of this seemingly unstoppable trend of pediatric falling in our institution. And we categorize them as patient-related, material, environment, method, immediate caregiver-related. So let's get to know them one by one. Okay, so for the number 1 root cause, toddlers by nature are curious and uncontrollably explorative. So with their hyperactivity, for this reason, 4 patients fell. Number 2, presence of underlying medical conditions such as body weakness and dizziness. For this reason, 1 patient fell. Unserviceable old beds, cribs that are still being used. So the defective side rails are not replaced. For this reason, 2 patients fell. KMC chair is insufficient, so mothers do KMC on a monoblock chair. So for this reason, 2 patients fell. Defective roof scatter, which results to pooling of water on the floor whenever heavy rain pours, making it wet and slippery. For this reason, one patient fell. Insufficient IEC or information education communication materials on fall prevention. As a result, full understanding of watchers on fall preventive measures is compromised. For this reason, two patients fell. Number 7, nurses prioritizing more crucial and critical patients. So nurses fail to orient immediate caregivers on fall preventive measures immediately upon admission. For this reason, 3 patients fell. And then lastly, number 8, unheeding attitude of immediate caregivers on fall preventive measure, such that they leave their patient alone and unattended, and they fall asleep while carrying baby in wee hours of morning. So there were 8 specific causes. However, when we subjected this to the Pareto chart, only 5 now remained. So let's go to our solution. Okay, so for the first 2 true causes, such as toddlers by nature are curious and uncontrollably explorative, and unheeding attitude of immediate caregivers on fall preventive measures, we counteract this. We intervene this with the creation of a fall prevention agreement. So as the name of the document implies, it's an agreement. It's an agreement between the nurse and the immediate caregiver. So they would have to sign their signatures in here as a sign to do their shared responsibility on fall prevention, especially to the parents. This would enhance further their sense of accountability and responsibility to look after for their patient while they are admitted in the hospital. And this is translated to Tagalog and Iloco dialect, the fall prevention agreement form. Okay, number 3, true cause, nurses prioritizing on more crucial and critical patients. So for this, we counteracted this with the creation of this instructional material as shown in this slide. So we can see here a mnemonic which says end fall. So each letter in here corresponds to a specific directive on how to prevent fall. And these are translated to Iloco and Tagalog dialect also. And then number 4, KMC chair ratio is insufficient. So we counteracted this by encouraging mothers to use tube blouse while doing KMC. And for the 5th true cause, unserviceable old bed or cribs that are still being used. So we counteracted this by prioritizing patients branded as high risk on fall to use beds with complete side rails. So the pictures here depict an actual orientation of a nurse on duty to a newly admitted patient. Okay, so were our solutions effective? Let's find out in our result. So in a 6-month trial period that is from July 2019 to December 2019, we reported 0 incidents of fall. There was 0 recurrence rate. Okay, so with that, what are the benefits we acquired in pursuing this study? Okay, so number 1, attainment of an injury-free reputation of the hospital. This is very vital as our institution is currently striving and surpassing the proficiency stage of performance governance system. Number 2, gain trust from the clients. Prevent unnecessary expenditure for the patient. I'm gonna expound this later. And then lessen workload for the pediatric residents, of course. The sense of accountability and responsibility of staff is enhanced. So that is for the intangible benefits. Now let's go for the tangible benefit. So in here, we're gonna compare and get the difference of the incurred additional expenditures when someone fell to that of the cost of the improvement or cost of the solution. Okay, so let's go first to the additional expenditure. So for this, for us to appreciate it better, let's make believe that a patient is for discharge today and then suddenly fell and then sustained some physical minor injuries. So of course, the PROD or the resident on duty would have to suspend the discharge. So the patient would have to stay for another day in the ward. So that will cost 800 pesos. Now, since my minor injury, the PROD might request for plain CT scan of the head, so that would cost 4,200 peso. And other related diagnostic procedures such as X-ray of the forearm, which costs 257 peso. If may kailangang isuture, so suturing, that would cost 161 peso. And since my incision, we need oral antibiotic, so that would warrant the PROD or the resident to prescribe antibiotics. That would cost 104. So if that would give us now a sum of 5,522 as the additional expenditure if someone fell. Now, let's try to compare that with the cost of improvement or the cost of the solution of this study. So what we all need here is the fall prevention agreement form, the document, which I'm saying a while ago. So that would cost 2 peso for the bond paper and the photocopying machine. Printing and lamination of the fall prevention measure material, which cost 50 peso, and the orientation of watchers on fall prevention measures through discussion of the fall prevention agreement will be costless. So that will give us 52 pesos. Now let's try to get the difference now of that additional expenditure to that of the cost of the improvement. That will give now the institution a projected gross saving of 5,470 pesos per patient. So that will be all. Thank you for listening.
Thank you very much, Mr. Mateo, and congratulations on your presentation. Finally, let's proceed with the third presentation to be delivered by Dr. Joseph John Bill. Sir, you have the floor.
Perceived social constraints and physical exhaustion among caregivers of adult hemodialysis patients. I am Joseph John Biel, Nurse 2 from Zamboanga City Medical Center, presenter, and the primary investigator of this study co-authored by Anita Despues. Chronic kidney disease is a global health crisis affecting 10% of the world's population. In the Philippines alone, one Filipino develops chronic kidney disease every hour, or about 120 Filipinos per million population per year. Today, more than 23,000 Filipinos are undergoing dialysis, and each patient has at least one carer, a caregiver who may be blood-related or not, who may or may not receive monetary remuneration, and who provides holistic care to the chronically ill. Caregivers are the covert patients of the society. Caregiving has been correlated to be stressful. When an impairment is severe and chronic, caregiving may be conceptualized as a chronic stressor. The primary stressor in caregiving is not necessarily an isolated event, but rather the extended situation of deterioration and dependency. The physical and social health of caregivers give rise for concerns among healthcare providers due to the direct effect it has on the patients. In this study, we utilize the input-process-output model by McGrath, where input refers to the caregivers of adult hemodialysis patients, and we utilize caregiving stress appraisal scale and expected to yield perceived social constraints and physical exhaustion. This inquest intends to explore the association of perceived social constraint and physical exhaustion among caregivers of adult hemodialysis patients. Specifically, it aimed to determine the presence of perceived social constraint and physical exhaustion and determine the relationship between them. Quantitative descriptive correlational design was utilized to determine the presence and relationship of social constraint and physical exhaustion among caregivers of adult hemodialysis patients of Zamboanga City Medical Center, Renal Center for Western Mindanao, and we utilize a purposive sampling and enrolled 57 respondents based on the given inclusion and exclusion criteria. Participation in the study is entirely voluntary with written consent and can be withdrawn anytime with no measures of coercion or deception and no identified harm or risk and no monetary involvement. This is a minimal risk study without any intervention applied to the participants. Confidentiality and anonymity are strongly observed implementing Data Privacy Act of 2012. The study has been granted approval by the Zamboanga City Medical Center Ethics Review Board for implementation. The Abbott Caregiving Stress Appraisal Scale, which measures social constraint and physical exhaustion, was utilized with reported Cronbach's alpha of 0.93, 0.95, 0.96 for social constraint, physical exhaustion, and the total score, respectively. In this study, scale reliabilities for the data were Cronbach's alpha 0.81, 0.89, 0.92 for social constraint, physical exhaustion, and the total toll, respectively. Demographic data were also collected to determine the characteristics of the respondents. Request to conduct the study has been submitted to Zamboanga City Medical Center, Nursing Service Office, and the research manuscript was submitted to Zamboanga City Medical Center Research Unit and was approved of ethical clearance for implementation. The questionnaires were distributed personally to the respondents during their patient's dialysis schedule, and directions were given to the respondents at the beginning of the survey. It was then retrieved and tallied. The time for completing the questionnaire was less than 10 minutes, and the survey was launched with an open window of 27 operational days, which does not include Sundays from October 1, 2020 to October 31, 2020. Data analysis toolpack in Windows Microsoft Excel were utilized to analyze the data. Descriptive and frequency statistics were utilized to describe and determine the sample population's demographic data, while Pearson's correlation coefficient has been utilized to assess relationship. We enrolled 57 respondents, where 21 are males and 36 are females. Among the 21 males, 8 were young adults, 7 are middle-aged adults, and 6 are older-aged adults. Among 36 female respondents, 6 are young adults, 14 are middle-aged adults, while 5 are older-aged adults. In this study, these are the results. Who perceives caregiving stress? 71.93% of all 57 respondents, 76.19% of 21 male respondents, and 69.44% of 36 female respondents. Majority of those greatly affected are male and female old-age adults. Who perceives social constraints? 77.19% of all 57 respondents, 80.95% of all male respondents, and 75% of all 36 female respondents. Majority of those greatly affected are male young adults and female middle-aged adults. Who perceives physical exhaustion? 54.39% of all 57 respondents, 61.90% of 21 male respondents, and half of the 36 female respondents experience or perceives physical exhaustion. Majority of those greatly affected are male middle-aged adults and female older-aged adults. The scatter plot graph shows a positive relationship between social constraint and physical exhaustion scores as evidently compared to the linear trend line. Pearson correlation coefficient shows a very strong positive correlation at R.86 between social constraint and physical exhaustion. This shows that those who perceive social constraint also tend to perceive physical exhaustion in caregiving of adult hemodialysis patients. Social constraint, physical exhaustion, and caregiving stress as a whole are perceived by most respondents regardless of sex and age. Caregiving stress is prevalent among males and females more than 55 years old. Social constraint among males who are 18 to 35 years old and females who are 36 to 55 years old, and physical exhaustion among males who are 36 to 55 years old and females who are more than 55 years old. The social constraint and physical exhaustion are correlated. We recommend to nurses and other healthcare providers to develop interventions such as primary prevention program and support groups in exploring the positive aspects of the caregiver role of family members or significant others with chronically ill patients, to hospital and/or dialysis center administrators to conduct a comprehensive study in developing a program that focuses on the caregiver's health needs, to public and private health sectors to help develop a social action plan that involves the well-being of the inexperienced family members who become informal caregivers of the chronically ill, and for the future researches to enhance the research design and to address limitations of the study. A future research could use an effective incentive to increase number of participants. A higher response rate can potentiate positive effect on the reliability of research findings by reducing non-response bias and identify the reasons for social constraint and physical exhaustion of caregivers and come up with interventions to address the concerns. And despite the physical exhaustion and social constraint of the caregivers, determine why do they still choose to become caregivers of the chronically ill. And here ends my presentation. Muchísimas gracias. Vaya con Dios y Dios te bendiga.
Thank you very much for your presentation, Mr. Biel, and congratulations. And again, I'd like to thank all of our presenter researchers today, and for all of your presentations. So now let's move on to hear questions from the audience. Our coordinator, Ma'am JJ, has monitored the chat panel and selected at least one question for each of our presenters to answer. So let's proceed with the questions, Ma'am JJ. Thank you.
For Ms. Yap, the question is, among those who declared reporting events, were you able to determine what units, departments they were from? And what is the reporting mechanism or procedure in this area? Is it the same across all areas?
Okay. Hello, good afternoon po. Here at the Southern Isabela Medical Center, we have a unified patient safety incident reporting and learning system. We had an algorithm of reporting, and together with the quality management system and the concerned units who reported the events, we conduct RCA and an action plan. That's it.
Thank you. For Mr. Mateo, our question is, were there near-miss falls in this study group? Did you have challenges in reporting?
Near miss fall. I'm sorry, ma'am. Near falls.
Near-miss falls in the study group.
Saan siya pumunta, girl?
Yung kumbaga po, malapit or almost po na fall. Ganun po ba? Miss fall. Actually,
Yes, sir.
It was a near miss.
all fell, ma'am. All of the patients fell po. And what's the second question, ma'am? Sorry.
The other question is, did you have challenges in reporting?
In reporting. Actually po, we have this incident logbook in every area, and once na may ma-fall po, we write that on the incident logbook and report that to our roving supervisor.
Thank you, Sir Mateo. And for our last presenter, Mr. Biel, the question is, was it a factor in their perceived social constraint, physical exhaustion, and caregiver stress if they were the primary or sole caregiver as compared to those who have multiple caregivers for one patient?
Hello, thank you for that question. Yes, in my study, one of the inclusion and exclusion criteria, the caregiver should be the main caregiver of the patient of the hemodialysis patient for at least 6 months with no alternate caregivers, or those caregivers who are paid or can go um, on leave. Uh, the caregiver alone should be the main caregiver for at least 6 months. And yes, it is the caregiver has a really huge factor in the results of the study.
Thank you, Sir Biel, for that answer. The
So-
floor is yours, Dr. Reyes, Dr. Betsy.
Thank you so much, Ma'am JJ. So thank you to our presenters and all those who asked their questions. So we actually have some time, and I'd like to give 2 minutes for our audience if they have any more questions, and then we can proceed. Or I'd like to hear a manifest if there's no more questions from the group. Again, congratulations. They were all very wonderful studies that you presented to us today. I know that, especially for the patient safety aspect, no, it's not all biostatistics. A lot of these come with um, very interpersonal strategies that have to be put in place. And even the way you communicate with individuals, no, malaking factor talaga siya. So I commend all of you for doing all of these studies. They're not the easiest things to do, and congratulations again. So if we won't have any more follow-up questions from our audience, we will end the Q&A section. So all the other questions posted or addressed or not, so you can still follow up with us in the team, shall be included in the documentation of this activity. And so for our synthesis, I'll just give a short synthesis of our session. So in this session, we were able to hear about the patient safety culture among healthcare workers in SIMC and their call to develop and fully integrate strategies for patient safety. We recognize that full integration in all aspects of healthcare is very challenging, especially because we have to keep developing them. We have to keep changing. We have to keep evolving and adjusting to the situations that we have. We saw how Mariano Marcos Memorial Hospital and Medical Center utilized root cause analysis to determine the true causes of pediatric falls and their focus on high-risk fall patients and subsequent prevention of falls, resulting into actual gross savings for their patients and the institution as well. And lastly, we saw in Zamboanga City Medical Center's presentation how perceived social constraint among caregivers of adult hemodialysis patients are correlated particularly with physical exhaustion, and that caregiver stress is an aspect of healthcare that should truly be prioritized and tackled, because we know that caregiver stress among health workers is definitely something we have to work on, but especially for those who suddenly become caregivers themselves, especially lay people. So, and that's all the time we have for this parallel session on patient safety and infection prevention and control of the Hospital Operations Track for the first National Hospital Week Research Forum. So as previously announced, there are 30 papers out of 60 being presented in this forum that are being considered for the best research paper. Winners will be announced and awarded at the closing plenary session of this forum tomorrow. The link to the post-activity evaluation form will be announced and posted as well, and all those who will be able to fill up the online post-activity evaluation form will receive a certificate of attendance in return. With that, we conclude this parallel session. And again, we'd like to thank all of you for your participation. You may now click on the link button or the round X button on the bottom right of the screen. And we hope to see you all at the closing and awarding ceremony. Again, I congratulate all of our presenters and the researchers for their wonderful work and their wonderful presentations. And thank you again. Have a nice day.